In early 2006, I was asked if I would take over as the chair of surgery and the chief of surgery. So I accepted that position, which I still have today. And then the responsibility became more than just transplant, but how were we going to rebuild the surgical department, the training program, what areas of surgery were we going, because of course we had lost a number of faculty. So what areas were we going to recruit, and strategically how would we look at that? And at that time, as I sort of alluded to before, it was very exciting because we could actually plan where were the needs in the community, what were the strengths we had existing, and where could we add on to them to sort of build for the future. So it's been a journey over the last 10 years. No one could predict what the population would be in Louisiana. So there were real questions about whether we should even restart the surgical residency, for example, or what size should the surgical residency be? How many patients would we have? How many faculty should we have? There were just a lot of moving pieces, and it took the support of the hospital and HCA, as well as the support of Tulane University and the medical school, to help put all this together. So the true story is, like so many people, I actually had job offers. And at the end of the day, literally on the kitchen table, I had two job offers. One was to go to UT Southwestern and be the head of their transplant program, and the other was to stay here as the chair of surgery. There were two main reasons that I decided to stay here, the most important of which was my wife, and we had looked at houses up there in Dallas. She said, look, I'm coming back to New Orleans, so if you go to Dallas, you can visit me on the weekends. That's probably the most important reason. But the other thing, which is really honest and true as well, is that at that point, I felt like there was a lot that could be done, a lot of challenges, but a lot of potential that really you couldn't get anywhere else, and that we had the opportunity to do things that were so creative because we had basically a clean slate to start from. So for example, the resident program, and we actually published on this, we completely redesigned the way we train surgery residents, which now is a model for a lot of places around the country. The old standard was more an apprenticeship model. You know, if you work with me, you're working with Doug Slakey just to do pancreas or just to do transplant. But we turned it upside down and we said, what do the residents need to learn? Not what's the expertise of the faculty, but what do the residents need to learn? And then how do we assign the residents at different stages during their career to get the skills, the intellectual knowledge and communication skills, etc., that they need at the time they need it. And so really we put the learner first as opposed to the faculty member first, which had been the tradition for over a century since Halstead started it at Johns Hopkins. So really it allowed us to do things like that in a normal, structured academic environment, you just would not have the latitude to do it. So it's pretty exciting. Well, New Orleans as a whole, it just changed so dramatically. I mean, there's so many evolving differences. So the population is rebuilt back. The population that's here now is a little bit different in some of the demographics than it was previously. The healthcare systems within the city have started to really coalesce and combine. So there's not as many independent practitioners or independent hospitals. So the business of medicine as it applies to our practices has changed a lot, and it's still evolving. Clearly there's been, from the federal government, a tremendous amount of money put into certain areas of healthcare infrastructure here. We just up the street from Tulane, we had, and well, it still continues, the largest healthcare building project in the entire United States, $2.5 billion of new healthcare infrastructure that we're part of. And so it just, those sorts of investments just are very uncommon. They don't happen very often. And again, it allows us to, for people like at my level, to look at opportunities to really see how we can make the vision of healthcare delivery better. And we can look not just at tomorrow, but we can look 10 years, 20 years down the line and say, well, what do we think things will look like? How can we optimize patient care? And how can we be part of really being on the cutting edge of taking new technologies and new innovations and applying them more rapidly perhaps than you could in other environments? Probably it's allowed me maybe to reflect a little bit more and maybe have a little bit broader perspective on what it means to be committed to a place and how you can actually make a difference as opposed to just moving around for your own personal gain. And sometimes that's, sometimes it's a challenge to actually measure that, but you see how you contribute to other people, other people's learning, patient outcomes, being a resource, a healthcare resource. I think that's super important, and that's a big part of what we try to do in the Department of Surgery. And those sorts of goals and initiatives, which are maybe larger than the individual, those are really hard to do if you don't have the perspective over a period of time. Because, and I think an important reason for that is because it takes a while to realize those sorts of gains. You can't accomplish those sorts of things in a year or two. Now, on the other hand, when it takes that long, there is some inherent frustration, because I think most of us, especially in the modern world, we tend to want instantaneous gratification. You want things to happen as fast as you send a text or an Instagram, but it doesn't always work that way. And I think that's a lot of what's given me sort of perspective on that. I hope I've already gotten to that point where that's behind us and it was something we went through. But yeah, I can tell you, in New Orleans, when you go out to dinner or talk to people, there's definitely a before and an after. And it's a definite defining period. And there's also a defining reality of people who were here and experienced the challenges and saw all the refrigerators out on the street and all the garbage and the trash and had the uncertainty about whether back or not, or have a job or not. I mean, those are important components of who people are at this time that went through it. But on the other hand, I think that the reality of where we're going and where we're heading now, we have to be beyond sort of the Katrina, and you can't blame things on the hurricane. You got to say, okay, this is where we are today and this is where we can go. And some of it is, as I said, some of it is realizing that we have a lot of investment that came after that, and we need to be at the point where we take advantage of it and not feel sorry for ourselves.